While tonsil problems are typically considered the domain of the very young, not all health issues related to the tonsils disappear once you reach adulthood. Tonsil stones are one such problem that's more common among adults than children. What is tonsillitis? Tonsil stones, also called tonsilloliths, are not usually serious but can become annoying for some individuals, particularly if they occur frequently. These small globs of calcified debris form in the crevices and valleys of the tonsils, and you can usually see them at the back of the throat. While tonsil stones aren't rare, many people may have them without even knowing because they're so small or don't cause enough irritation to become noticeable. One 2014 study found the incidence rate to be about 8% for the population studied, which ranged in age from 9 to 87 years, and other studies have found that between 5 and 10% of people experience tonsil stones from time to time. What are the tonsils? Tonsils are glands that sit at the back of the throat. They're lymph nodes that happen to be in your mouth, and they sit there on the side of your throat, forming part of your body's first recognition of outside things like cold, viruses, and other infections like strep throat. These glands help fight infectious agents that can enter the body through the mouth or nose. Tonsils tend to be larger and more active in children, and as we age, they shrink and their immune function becomes less critical to our overall health and well-being. This is why it's usually okay to remove tonsils in children who have repeated infections or cases of tonsillitis. However, in people who keep their tonsils into adulthood, some of the changes they undergo can actually increase the chances of developing tonsil stones. We all have bacteria in our mouth and food and other particles that can get trapped, and they have the potential to form these stones. If the tonsils are irritated, that can increase your risk of developing tonsil stones. When the tonsils get swollen, these pockets get deeper. Some tonsil stones may have sharp edges, too, which can further irritate the tissue, leading to pain and swelling. What signs or symptoms do tonsil stones cause? For some people, tonsil stones don't cause any noticeable symptoms. For others, a sore throat might signal that a tonsil stone has developed. A visual check will usually confirm that a yellow or whitish deposit is lodged in the soft tissue at the back of throat. A sore throat can also be a sign of tonsil stones. Sometimes there can be some irritation from the stone being there. Bad breath, also called halitosis, can also be a symptom of tonsil stones. Most of the time, tonsil stones are not a major problem and will resolve on their own. It's usually fairly easy to dislodge a tonsil stone with your finger or a Q-tip, but not recommend as it can cause bleeding. Stubborn tonsil stones may need the assistance of a doctor with a tongue depressor to remove. A water pick, also called an oral irrigator or water flosser, can be used to dislodge tonsil stones. In the most extreme cases of chronic tonsil stones, your doctor may recommend a tonsillectomy, surgery to remove the tonsils. This form of surgery is much more common among children. That such intervention can be much more challenging for adults than for kids. Tonsillectomy is no joke. It's super painful if you're not 6 years old anymore, usually causing significant pain for a solid 7 to 10 days, and often necessitating the use of narcotic painkillers. Therefore, only in the most extreme cases would tonsillectomy be recommended. How can I prevent tonsil stones? Rinsing your mouth out after eating to help wash away debris that could develop into a tonsil stone. If debris isn't permitted to build up, it'll be less likely to harden into a stone. I recommend a gentle saltwater gargle a couple times a day to people who have them occurring repeatedly. Many mouthwashes contain alcohol that can further irritate the tonsils. Instead, simply adding some regular old table salt to room temperature tap water and gargling for about 30 seconds works well to flush out any debris that's built up and could cause problems. While there isn't much you can do from a dietary perspective to reduce the chances of developing tonsil stones, they're more common among smokers. Anything that causes inflammation in the throat, including smoking, will tend to make the tonsils irritated, and then you get these pockets that are deeper, and that's what sets you up for this. So if you're a smoker who's having trouble with tonsil stones, that's just one more reason to kick the habit. Please take a moment to subscribe to our YouTube channel so you'll be the first to know when we post new content.